Well, good evening, everybody. Welcome to this question and answer session where we're going to be talking about many of the things that people are asking about the COVID-19 vaccines. My name is Richard Green. I'm the pastor at All Nations Church in Bedford, and it's my privilege to welcome you all here this evening. And I realise that we've got people from all walks of life, all parts of our community, and you are so welcome. And we hope that this will be a really positive time tonight. Hope it will be helpful. Our aim tonight is really to put good information into your hands and obviously to dispel much of the misinformation and sadly fake news that often goes along with this subject. So that's our aim tonight. Just a couple of ground rules really. We want this to be a very kind and respectful time. We are very blessed with a very distinguished panel tonight, and they're going to do their best to serve you, and they'll be introducing themselves in a moment. But I just want to encourage us all to, when we do get the opportunity to ask questions, to do that in an honouring way. And we want to make sure that this is a really good time for everybody here tonight. So that's really all I want to say. It's our pleasure to host this, and I'm now going to hand over to Mr. Sam Tuwedi, who is going to be our host for the evening, and then we're going to introduce our panelists. So Sam, over to you.
A very good evening to everybody. My name is Sam Tuwedi, as Pastor Richards just said. And the main reason why we're having this tonight is for us to be able to debunk some of the myths out there. So we got an distinguished panel. We're going to be speaking to you tonight to be able to give you information that hopefully will empower us and to clarify issues for us. So we know taking the vaccine is a matter of choice. So, but this is just to be able to create an opportunity for people to ask questions so that they are clear on what it entails. Now, one of the main reasons why this has been brought together is because of the fact that, particularly in the BAME community, we noticed that people are not taking this as much as they should. They're not signing up for it. So it becomes very important that we get everybody together, all right, to be able to dispel any rumors out there or any myths. So, and that's why we're together this evening. So I'm going to be hosting this event alongside Bumi Alade, which is going to be my co-host. So I'm going to be calling on Bumi to tell you what's going to be happening and how the event is going to be this evening. So over to you, Bumi.
Good evening, everyone. My name is Bumi Alade. So just to reiterate what Mr. Tawade and Mr. Richard has said, the purpose of this evening is really to inform, to educate, and to create awareness about the COVID vaccine. We've been honored to have some very learned people that have given up their time to come and answer those questions and really just help us to make an informed decision. The session is going to be an interactive session. We will be taking questions from three main groups. So there was a survey that was sent out earlier. Some of you would have responded to that survey, and some of the questions that would be raised this evening would be taken from that survey. We would also be taking questions within the chat, so please feel free to put your questions in the chat. We would also be taking some live questions. Also, just a gentle reminder that a number of people have given up their Saturday evening to come and share their knowledge and their experiences. It's meant to be an informed decision so everyone can make the right choice for themselves. So let's just be respectful in the type of questions that are asked and just really just honor the people's time that have been volunteered for this event. I will now be handing over to the panelists. So I'll call the panelists one by one so they can introduce themselves, give us a bit about where they've come from and why they've joined us tonight. So I'll start with Dr. Floriana Ellis, if you'd like to introduce yourself.
Hi everyone, thank you so much for listening and joining us this evening. It's a great privilege to be here, and we really love to talk about COVID vaccination. and giving more information about the vaccine. So hopefully you can make the right decision and attend for the vaccine. So I'm Floriana Ellis. I'm a doctor from Bedford. I'm a GP, and I also work with CCG as a clinical lead for children, young people, and maternity services.
Thank you, Dr. Ellis. And next, I would call on Dr. Kuku. You're on mute, Dr. Kuku.
There we go. Sorry about that. Yeah. Hello, everyone. My name is Dr. Kuku. I'm popularly known as Dr. K. And I'd first of all like to say thank you to Richard, thank you to Sam, thank you to Bumi, thank you to my colleagues, and thank you to every participant, everyone who's actually in the audience. We appreciate the fact that you've taken time out on a Saturday. And I guess a lot of us are hungry for knowledge. Knowledge is power when well applied, and that's why we're here today. My name is Dr. Daya Kuku. I'm a GP. I'm a local GP in Bedfordshire. I'm also the clinical lead for the CCG for respiratory conditions. I'm passionate about all things COVID-19. And the reason why I am is I noticed that a lot of people, especially the BAME, which are the Black, Asian minority ethnic group, are not coming forward to take the vaccine when offered. The reason why that's very important is there is something called herd immunity, and that simply means the larger number of people that are vaccinated, the sooner we can get out of this pandemic. I don't know about you, but I am fed up. I'm fed up with the lockdown. I want to get out. So this session, just as well said by Bome, is for information. It's for scientific information. We want to share evidence with you, and hopefully that would get rid of the misinformation. There's a lot of misinformation on social media. I've seen quite a few of them, which could be very convincing, but we are here with no agenda. We are not here to convince anyone. We're here to empower you to make informed decisions about taking the vaccine. You'll be glad to know that I am real. I have taken the vaccine. So I took the Oxford AstraZeneca vaccine, and I'm not backing, because there's a myth out there that says you'll be backing when you take it. I haven't been tracked. If they want to track me, they use my mobile phone or my bank cards. So we'll talk a bit more about the side effects as we go along. So I just want to encourage us to listen carefully, take the information in, not only take it in, but also use it. Use it to make an informed decision. Above that, share the information with your friends, your colleagues, and if you have enemies, share it with them also, because we want everyone to get the vaccine. Thank you. One last thing I'm going to say is, if you look on the screen, you'll find there's a QR code. There's a QR code on the screen, on my screen. If you can use your mobile phone to take a picture of that QR code, and what it will do is give you the opportunity to get a COVID-19 ebook. So I have an ebook which I have created. It's free of charge, no strings attached. All you need to get it is your email address. So when you scan that QR code, it will ask for your name and your email address, and then we can send the ebook to you. The other way to do it will be to go on my Instagram page, which is Healing G Zone, and you can click on the link in my bio, and that will give you access to the ebook. The ebook is the frequently asked questions, all written out with lovely pictures to go with it. Thank you. I'm done speaking.
Thank you, Dr. Kuku. And next, I will call on Dr. Barati to please introduce yourself.
Hello, thank you very much for having me here. And I'm Dr. Bharti Kumaravel. I'm a consultant in public health. I work in Bedford Borough Council. I lead on health protection, and I'm passionate about raising awareness and answering any queries you may have around the vaccine. We are working very closely with our ethnic minority communities across Bedford Borough, Central Bedfordshire and Milton Keynes. We go out into the community, we speak to faith leaders, we go to lunch clubs, and where possible, we talk and raise awareness around any immunization and screening. I'm also a senior clinical lecturer at the University of Buckingham Medical School, and I lead on public health and evidence-based medicine. So I'm here to provide you any evidence behind any queries you may have, and happy to be on the panel tonight.
Thank you, Dr. Barati. Next, I would call on Dr. Saleh Ahmed.
Good evening, everyone. I'm Dr. Saleh. I'm a local GP in Bedfordshire. I have been a GP for about 5 years or so now. I'm from Bedfordshire, grew up, born and bred in Bedfordshire. And one of my biggest passions in life is the community itself. And something I've learned throughout my time being a doctor and a medical student is one of the things that our people struggle with the most is access to healthcare and access to knowledge. There's many things that are available to people, but a lot of my patients have no idea that it's something that is available to them, or they should have been worried about a certain thing. And so I'm very passionate about trying to spread good information, because clearly there's been a lot of misinformation around about COVID and the COVID vaccine. So I'm very happy to be here.
Thank you, Dr. Saleh. And I'll now call on Dr. Linus as well to introduce himself.
Thank you, Bumi, and good evening, everyone. My name is Linus Ona, and I'm a local GP at the Ivell Medical Center in Biggleswade. And I want to welcome everyone who has taken the time to join us on the call this evening, and also to say thank you to my colleagues and the organizers. I'm hoping that tonight we'll be able to have discussions that are genuine and that we're able to sort of also listen to any concerns that our guests, people on the call do have, and hopefully we might be able to address those concerns. I think it's important that people feel comfortable to be able to ask questions and to know that, you know, it's not it's a non-judgmental, a safe space for you to ask any questions, and we're going to try as much as possible to answer those questions. And where we do not know the answers, I promise you we're going to be honest and say that we do not know the answers. But the goal is that at the end of the evening, that hopefully you will have found it useful, you'll have had hopefully any concerns addressed, and you have been in a much better position than when you joined the call to make the decision that is right for you and for our community. And the point about the community is important, because the thing that is different with COVID is that it's a condition that is afflicting us as a community together rather than as individuals. So welcome to the call tonight, and I'm looking forward to learning from and hearing from all of you. Thank you.
Thank you, Dr. Linus. Just a gentle reminder again that the purpose of this session is to inform, to educate, to create awareness so everyone can make an informed decision. So thanks again. The session will be recorded, just so you're aware, so that it can also be shared with the wider community. Now I will be handing over to Mr. Sam Tawade, who will be asking some of the questions that were provided via the survey. Over to you, Mr. Tawade.
All right, thank you very much, Bumi. Thanks for that. Like Bumi said, a couple of questions had already been sent in. But looking at all the questions, we can group them because they seem to be asking the same thing. So this question is going to be directed at Dr. Kuku. And the first question there is this. We all know it was quite rushed. This is referring to the vaccines due to the impact of the pandemic. How are we sure that it is safe? Dr. Kuku?
Sorry, I should stop putting myself on mute. Yeah, I'm sorry about that. Yes, so that's a very important question. And just like Dr. Linus said, every question is valid. There is no stupid question today. And people have asked this question over and over again. And it's not surprising that that question is being asked, because in the normal world, pre-COVID, to authorize vaccines, it would normally take 18 to 24 months. But this time around, the COVID-19 vaccine has actually been made available within 10 months. So that's really a short period of time. And that's why people ask this question. The short answer will be yes, it is safe. My long answer will be an explanation of why I say it is safe. So I say it is safe for four main reasons. The first one will be, the overarching reason will be that, yes, we haven't cut corners. Corners have not been cut. What has been cut is the red tape. And what I mean by the red tape is usually there's a bureaucratic process in the production of the vaccines. You have to go through one loop after the other, one step after the other. But what has happened this time around is things have been staggered. So instead of waiting for one step to finish and then the next step, and that's why it takes a bit of a longer time, they've worked side by side to bring this, to make the provision of this vaccine quick. The other reason why we've had this vaccine provided for all of us quickly is the fact that a lot of funding has gone into it. Because of the impact of COVID-19 on the whole world, there has been a lot of funding pumped into it. The other reason why it has come out in such a short period of time is there's been a lot of scientific collaboration, global, worldwide. So all over the world, scientists have come together. They've worked together this time because of the impact of the deadly virus causing the COVID-19 disease. The fourth reason why it has been brought out in a very short period of time is actually the fact that I'm sure all of us have someone who's been impacted. You have a friend, you have a relative, you might even have a parent. I have colleagues that have died from COVID-19. So this time around, there has been a lot of volunteers. In the past, you have to wait for a long time, as actually trying to get people to sign into the trials. But this time around, a lot of volunteers all over the world have voluntarily signed into the trials, and this has made the production of the vaccine very quick. So that's the reason why it has been brought out in a short period of time rather than a long process. So in summary, there has been no compromise on the efficacy of the vaccines. There has been no compromise on the safety monitoring of the vaccine, which is still ongoing. And we also need to understand that we have a regulatory body within the United Kingdom, which is the Medicines Healthcare Products Agency, that actually went through the process, and the vaccines were given an emergency license so that we can actually use them sooner rather than later. So I hope that answers that question and puts your mind at rest that the vaccine brought out in a short period of time is still safe because it has gone through due diligence and none of the necessary processes have been cut. It's just been speeding up to make it available quicker. Thank you.
Thank you very much for that. The next question that has been sent in is, and I'm going to direct this to Dr. Linus, what exactly is in the vaccine? Will they have any ingredients which are unsuitable, particularly for religious groups, vegans, allergies, and so on and so forth? Dr. Linus.
Yeah, thank you very much. I think Dr. Saleh wanted to add some more information to the previous question. Do you want to get to him first, or should I
Yes,
go on with
I
you?
think that will make sense. I didn't see that on the screen, so sorry about that, Dr. Saleh. If you want to go on first.
Just very briefly, just to add from what Dr. Kuku said, a great analogy that I came across to help understand the development of the vaccine, which I spoke to my family about as well. So imagine getting up in the morning to go to work, and you've got a commute into London and you've got to drive into London. At rush hour traffic, you're going to be met with lots of cars, queues and bottlenecks wherever you go at junctions. There might be an accident, which will hinder your progress to get to work for a certain time. And that's sort of how the bureaucratic system for research and vaccinations has been over the years. When the COVID pandemic hit, it's a bit like now getting up to go to work and the entire road in front of you is completely empty. All the traffic lights are green and you have no queue or blockers anywhere that you go. And that's what sort of led them to be able to get the vaccine out as quickly as they have done. Secondly, there's been massive collaboration that's happened between different organizations, whereas before it might have been kept, my lab would be secretive about what we were doing versus what someone else would be doing. But there's been open collaboration. And finally, as Dr. Kuku said, there's been a bottomless pit of money that's been put forward to try and get to a solution to this problem. And so that's what's led to such a rapid rise in vaccinations.
All right. Thank you very much for that. So, what does the vaccine contains? And this question going to Dr. Linus. What exactly does it contain? And there's been specific mention of the fact that some people suspect that there are ingredients which are unsuitable for religious groups, for vegans, allergies, and so on and so forth. Dr. Linus.
Yeah, thank you very much. So the essential ingredients for the 3 vaccines that have been approved for the UK are what they call mRNA, which is a blueprint of information that tells the body to make substances that would prepare the body to be able to recognize and fight off COVID infection when somebody becomes exposed to it. So this blueprint is called mRNA. Now, in the Oxford AstraZeneca vaccine, this mRNA is inserted inside a vehicle, which is a chimpanzee virus, which does not cause any harm to the human body. So those are the essential ingredients for the Oxford AstraZeneca vaccine. For the Pfizer and the Moderna vaccine, this blueprint mRNA is wrapped around a fat envelope. Now, the point of using those envelopes and the chimpanzee virus for the Oxford vaccine is to be able to get the blueprint into the human cell where it will then begin to work. There are other ingredients, and if Dr. K will enable me share screen, it says that the screen is sharing is disabled. I might be able to show you a screenshot of the ingredients in both the Pfizer and the Oxford AstraZeneca vaccine. In summary, there's nothing in either vaccine that is prohibited by any of the major religions that Christianity, Islam, Jewish religion, or Hindus, or Buddhists, or any of the other religions that we commonly are aware of.
You can share now.
I'm sorry.
You can share now, sorry.
Right, okay. There is no known animal products in either vaccine. So again, that hopefully would reassure people. So I'm showing you, and hopefully you can see on your screen, a screenshot of the contents of the Oxford AstraZeneca vaccine. You can take a picture of this, or if you want, save a copy of it. But basically, if you look at the list of items, all these ingredients are things that are commonly contained in common medications that you buy over the counter, things like your cough syrup or things like that. So you can even see sodium chloride, which is basically table salt. You can see water for injection, which is basically water. There's a tiny amount of alcohol in the vaccines, but it's really, really very tiny. It's much less than you would find in sort of common fizzy drinks that you buy over the counter, which also contains a little bit of alcohol. And we've had clear messages from religious leaders, the Muslim religious leaders and the Jewish community, as well as Christian leaders and the Buddhists and Hindus endorsing these vaccines. I'm going to try and show you the Pfizer vaccine, and hopefully, so you can see the content of that one as well. So these are the components, and hopefully you can see on your screen the components of the Pfizer vaccine. So again, these substances here are very commonly found in medications that you can buy in your local chemist. Again, you can find sodium chloride and water and sucrose. Sucrose is basically sugar. Cholesterol is fat. And obviously, these things are present in tiny amounts. Now, one thing that is important in this particular vaccine is the substance called polyethylene glycol, the second thing. And it's important. We're going to talk about it a little bit more when we answer questions regarding allergies. So I hope that helps. But in summary, there's no substance in either in all three vaccines approved for the UK that is either of animal origin or that is forbidden by any of the major religions. Thank you.
Thank you very much, Dr. Linus. There's a lot of questions popping up on the chat page. So I'm just going to ask one more question so that this becomes very interactive. All right. And we're just not talking at you. So this question is for Dr. Flo. And the question is this. It says, there's a lot of discussion about natural remedies to treat and prevent COVID. So why can't people use this instead of taking the vaccination?
That's an amazing question, and I wish I have an amazing answer to that. I will say that as you've noticed around you, so many people have died, so many people develop complications from this very, very unusual virus, and it's not like any other virus that we ever came across. So it's really, 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 really unlikely that there are any natural remedies that can actually help. So regardless, obviously the scientific people have done so much research on this. So, and I'm sure they looked at all sort of things, and obviously nature is very close to their heart, and they looked at a lot of things, and obviously they came up with this, with these vaccines. And I will ask Dr. Barati to come in and add a little more scientific evidence there. Thank you.
Yeah. Thank you very much, Flo. While people with mild symptoms may benefit with rest or taking fluids or paracetamol, people with severe infection, they need medical treatment. And in the internet, we have a lot of unproven home remedies for COVID-19. Often, they are not evidence-based. Just because a product is labeled natural or herbal doesn't necessarily mean it is safe. And we need to be really careful because some of them can cause serious harm and some can be toxic as well. Misinformation can be dangerous. So I would just say that be careful when claims are made that which are not recommended by the NHS or a well-recognized professional body or society. If someone is talking about home remedies, just make sure where is the source, what's the source, who is saying that, and then make an informed decision. But to date, if it's just mild infection, then you can take some paracetamol and fluids and rest. But if it's serious illness, you need medical treatment. That's the only way.
I'd like to add on to that also. I just thank you, Flo and Dr. Bahati. Those were quite enlightening. The way I'd like to also answer that is, imagine you go to war and you go to war without ammunitions. What will happen? There is a chance that you might survive because if the bullet doesn't hit you, then you will survive. But that's like taking a big risk. What do the vaccines do? The vaccines help your body build up immunity and prepare your body to fight that virus in case it comes in contact with you, in case you come into contact with it. It prevents the virus. The vaccine actually prevents not you getting the infection necessarily, but you getting the risk of complications and even the risk of death, risk of hospital admission. So if you decide to use your natural products, our bodies are built to fight infection, and we have a bit of natural immunity. But you're taking a very big risk against a deadly virus that is multi-system, multi-organ. So it doesn't affect just one organ, it affects almost every part of the body. So if you decide you want to use natural products, it's a big risk because it's almost like going to war without the ammunitions. If you have the ammunitions, your chance of winning is higher than if you don't. So it is good to use the natural remedies alongside the vaccine. That is what the recommendation will be, rather than depending on your body to just fight the deadly virus naturally. The evidence also is the fact that if your natural immunity would last for only so long. The vaccine, what it does is it gives you extra immunity and also longer immunity. So it's very important that we're aware of these facts when we're making the decisions as to how we want to deal with it. Thank you.
Thank you very much, doctors. Just needed to point something out, and this is for Dr. Barati. Before we go to the chat page, I'm going to be calling back on you because I would love to know from you. Out of these home remedies, you said that some of them are provide risks. So I think it will be good for you to actually enlighten people about some of the risks that can associate with some of these things that you've mentioned. So I don't know if you want to go now or you want to come back to that later, but I would just want to, because you mentioned that, so it'll be good for you to tell people what are some of the risks associated with home remedies.
I think it depends on what home remedies we are trying. Because
Okay.
there's a lot of home remedies, and people, it's something mild like pepper, and people use alcohol, and some people even use colloidal silver. And some of them can be really harmful, and some of them can be really toxic as well. So it depends on what you take, and then it can cause really serious, just some gastrointestinal upset to really something really toxic effect. So it depends on what you take.
Okay.
So I would just say, if you're not sure, before taking any other home remedies, just check where is it, who is recommending it. If you're in doubt, go to some recognized organizations, NHS, gov.uk, or some established, well-recognized professional body or society. Go to your GP, ask them. And if they are recommending, you can trust them. If it's not recommended, please don't take it.
Okay, thank you very much for that. So that we started by saying that we wanted this to be interactive, and I can see that the chat page is is on fire now. So Bumi is going to be looking at some of those questions, and can I also appeal to some of the doctors to look at the chat page and see if there's any input you can put along that side. Okay, so Bumi, over to you.
Okay, thank you very much. The first question I have is, does the vaccine have an effect on fertility? I would pass that on to Dr. Saleh.
As far as we're aware, there is no effect on fertility. So at the beginning, when the first the vaccinations were first authorized by the MHRA, they were talking about people delaying taking the vaccination if they were planning to get pregnant for at least 3 months after they'd had the vaccine. That information has now changed with more evidence coming to light, and the Royal College of Obstetrics and Gynecology, which is the sort of body that deals with pregnancy and antenatal care, do not advise people to delay any vaccination. So there's no evidence that the vaccination gets anywhere near male or female reproductive system in any way, shape, or form. In terms of people that are actually pregnant, then again, there's no evidence to suggest that the vaccination causes any harm to the baby, but a decision should be made based on an individual's risk. So it's a conversation to have with your doctor about what your individual risk of getting COVID is and what your individual risk of serious complication from COVID is. So for example, to make it simpler, if an individual is pregnant, but they're an ITU nurse, then actually the risks of them getting COVID and having an adverse outcome probably outweighs any potential risk towards the baby. And it would probably be advised, it would be better for them to have the vaccine. If someone's working from home and is not exposed to much COVID at all, and they're staying at home largely, then it may be worth them delaying any vaccination.
And also, as Dr. Ahmed mentioned, yes, it's underlying conditions. So if you do have certain medical conditions already, like diabetes, high blood pressure, obesity is again a higher risk, and also being from Black and Asian minority, then will increase your risk to develop serious COVID illness. So then yes, if you're pregnant, you should have the vaccine.
Thank you very much, doctors, for the responses. I'll ask another question on the chat, if that's okay, Mr. Taraday. Should I carry on? Okay, the next question we have is, I heard it lowers your immunity. Apparently it does not stop transmission. It just stops more serious side effects. So would you like to expand on that? I'll go to Dr. Linus.
Thank you very much. Just before I answer that, I wanted to acknowledge a message sent by PJ Lightman on the chat, saying that he's booked his jab in 10 days and he's happy to have it, and saying that he was happy for the effort that we're making. So thank you very much, PJ Lightman. I understand that did you say you're hard of hearing or something? But I hope that the message gets across to you. Somebody should reply to him on the chat if possible. Thank you. Now, the question that you were asking was about whether it has any effect on transmission. And the fact is that when the vaccines were trialed, when they were testing them earlier on in their life, um, whether they stop spread from person to person was not one of the things they tested for. They were basically testing to see if the vaccines would stop people from developing symptomatic COVID. So that is COVID infection with symptoms. So because of that, the results of the test that they did could not answer those questions as to whether it stops transmission or not. So it may be that it does. There's actually some signals within the trial data that I have seen that suggest that it does. But because that question wasn't specifically addressed, wasn't specifically targeted in the trial design, we're not able to make any categorical statements one way or another. Now, I want to explain that this is important for two reasons. One, it tells you how thorough these tests are. So even though tests have been done, these tests were designed to answer very clear questions around safety and the effectiveness, whether the vaccines work and whether they are safe. And we have the answer to those questions. And it's yes to both questions. They work, they are safe. But they haven't addressed the question of whether it stops transmission. So because of that, the scientific community and the regulators are open and transparent enough to say, we don't know the answer to that question. I think that should give us confidence about the transparency of the whole process. There's no intention, as far as I can see, for anyone to pretend as if they know the answers that they don't know. Now, this is important because when you have had the vaccine, you're advised to stay at home and follow public health advice, which currently in the UK, the advice is that you stay at home and only leave for essential reasons. And then when you're out for essential reasons, you need to be mindful of the advice around hands, face, and space. We don't know if it stops the transmission. And because of that, even after you've had the vaccine, please follow the public health advice. Thank you very much.
Thank you, Dr. Linus. There was a second part to that question as well.
And what was that, please?
And that was, does the vaccine lower immunity?
Right. The answer to that is no. I haven't seen any evidence that suggests that it lowers immunity. What it does is very straightforward. We actually, so this relates partly to the initial question about how fast this vaccine was developed. So although the vaccines were developed since middle of last year, summer, actually what they call platforms, the way the systems that were used to deliver this vaccine have been in development for about 10 years. So actually we understand a lot about how this sort of vaccines work because they are not new in that case. It's almost like you're making a sandwich and you know how to make a sandwich, but you need to change the fillings each time. So what the scientists have done in the last 12 months is basically to change the fillings in this sandwich, which is the vaccine. But they already knew how to make this sort of things and they already knew how it works. So it doesn't lower immunity. There's no feasible way by which it can lower immunity. I hope that helps.
Thank you very much, Dr. Linus. I'll just ask the next question, and this will be to Dr. Kuku. Is it true that Moderna was a chemotherapy company for cancer?
I'm going to move that on because I don't know the answer. So
I'm happy to answer that.
Linus can answer that, sorry.
Yeah, so Moderna was founded, I think, about 10 years ago or so. And initially, it was founded to focus on chemotherapy. So that's correct. But actually, it was founded to focus on chemotherapy medications based around this mRNA, this chemical blueprint called mRNA. Now, along the line, they've expanded what they do because they found out that actually mRNA can be used for a wide range of things. And in fact, the initial hopes that they had that the mRNA would be a way to develop cancer medication did not quite work out as intended. So up till now, as far as I know, Moderna has not been able to roll out any successful anti-cancer medication. But the person who asked the question is right, that initially when they set up the company, the original focus was to make medication for cancers. However, as it turns out, and this is very common in science and medicine, usually you develop something for one thing, but you find that it has other uses. And I'll give you an example, a very quick example. The medication called Viagra, which we now use commonly for erectile dysfunction, was developed to treat hypertension of the lungs. That was the intention why it was developed, but they found out actually it had much better uses, and that's why they're now selling it for a different reason. So there's nothing unusual about this. It's just that they found out that the platform they developed was much better at vaccines. And I think that's a good thing. Thank you.
Thank you, Dr. Linus. I have a comment and a question here, and I'm going to read it out. It says, surely it's better to have the vaccine rather than to be in ICU. This, I feel, is so important to have. Is there any reason why people shouldn't have this? As a Christian, as we are, we feel that this is important to have. So my interpretation of this is the person is saying it's a lot better to have the vaccine than be in ICU. And also, is there any reason why Christians shouldn't have it? But mindful of the fact that we also have non-Christians on the call. So I would ask Dr. Kuku to answer for the Christians. If we have other religion representatives within our panel of doctors, please feel free to add on for the religion you represent after Dr. Kuku has spoken. Thank you very much.
Thank you for asking that question, and it is an important question. So one of the myths out there is the fact that for Christians, there's a myth out there saying if you take it, it's similar to taking the mark of the beast, which is 666. The answer to that is no. And the answer to that is no, is if you read the Bible, you would come to the understanding that the mark of the beast is actually after rapture. We haven't had rapture yet. So that, for me, that's a simple answer, that the vaccine has got nothing to do with the mark of the beast. There's nothing in the Bible that prevents you or discourages you from taking the vaccine. Medicine is also, so science was produced by God. Science is used by God. For Christians, the message is you put your trust in the God of the science, not in the science. But that doesn't stop you from taking the vaccine. Medicine is used for the benefit of mankind. The other part of the question, I think, was about contraindications. Am I right? Is there anyone who can't have it?
Yes, is there any reason why people can't have it?
So there's just one group of people that there is a contraindication to the vaccine. And the contraindication is if you have had one dose of the vaccine and you have an anaphylactic reaction to the vaccine, then you shouldn't take the second dose. I'll explain that a bit further. When we talk of anaphylaxis, we're not talking of the simple skin rashes and itching and simple allergic reaction. We're talking of the severe form of allergic reaction, whereby you have difficulty breathing, you have choking sensations, you might have swelling of your face or your tongue. If you have any of those reactions, then you shouldn't take the second dose. Apart from that group, everyone else is encouraged to take the vaccine. It doesn't put aside the fact that you could have allergic reactions. If you have allergic reactions, and anyone could have an allergic reaction to any medication, to food, to vaccines, what has been put in place is when you have the vaccine, you are told to stay in the venue for at least 15 to 30 minutes. The reason being, if you're going to have an allergic reaction, most of the time it's within the first few minutes of taking the vaccine. And it's an immediate reaction. The healthcare professionals are well trained and equipped to deal with any serious allergic reaction when you take the vaccine. And I like us to think about it. You don't know if you're going to be allergic to penicillin until you take it. But once you've had that one allergy, then you don't take it again. People have allergy to peanuts, 1 in 80. Allergy to penicillin, 1 in 80,000. Allergy to the vaccine is very rare so far, even though there are side effects. So the group of people that the vaccine will be contraindicated for will be those who have an allergy, an anaphylactic reaction to the first dose. On this note, I'll also like to mention what Linus said previously. The Pfizer vaccine has a particular component, the PEG, which some people are allergic to. If you have a known allergy to it, what is recommended is that you let the vaccinators know that, and you will be offered the Oxford AstraZeneca vaccine rather than the Pfizer, because Oxford AstraZeneca vaccine doesn't have that particular component.
Thank you, Dr. Koko, for that. I was just going to ask if there were any other religious backgrounds represented among the doctors we have on the panel.
Oh, I'm a Hindu.
Okay, would you like to answer the question about whether Hindus should not have the vaccine for any reason, please?
There are no religious reasons behind whether you have the vaccines or not. And according to the Hindu religion, again, there's nothing here which is against Hindu religion in what is there in the vaccine. So I'll encourage everyone to have it.
Okay, thank you, Dr. Bharati. I don't know if anyone has any knowledge about whether there's any reason why Muslims should not have the vaccine among the panelists.
So I'm of Muslim faith, and it's been discussed greatly by the Islamic scholars, and there is an organization called BIMA, the British Islamic Medical Association, who are a bunch of Islamic scholars as well as doctors and research scientists that have looked at all the data and the ingredients and have categorically said that it's fine for people of Muslim faith to have. There was a little bit of debate about the AstraZeneca vaccine because of the small amount of ethanol that it has in it. But when they looked at it further, they reminded us that actually most drinks that we buy from the shops, like your can of fizzy pop, will have a small element of alcohol in it through a natural fermentation process, which is completely permissible and nothing for anyone to be concerned about. Thank you.
Thank you very much, Dr. Saleh. I'm going to ask one more question, and if it's okay with Mr. Sam, I would like to move to some live questions after this next question from the chat, and then we can always come back to the chat. So one more question from the chat. Is this vaccine registered so that if we get side effects, we can go to court with it, like thalidomide? And there's a further question or further response down the line, which says apparently the law has changed, so there's no legal comeback. And for them, that is a red flag. And I would ask that to Dr. Kuku.
So the question is that, thank you, that question is frequently asked, and it's about litigation and can you sue people, can you sue the company for doing it? Thanks to the person who said there has been an update. There is no legal comeback on it. This vaccine has been produced for the benefit of everyone. And what we find is that because it was produced at such a short period and as an emergency venture, it is used under the emergency license, which means it's actually being used just to make sure that we try and deal with this deadly virus at a short period of time. So the people asking the question, my answer will be, for everything in medicine, the ethos is first do no harm. And that is what this vaccine is about. It's about first do no harm. It's about dealing with a deadly virus that could lead to death. And if it doesn't even lead to death, could lead to complications. So we've heard about the long COVID, which is a condition where after the acute illness, you have ongoing complications from 4 weeks into 12 weeks and even over. And these are the different things that the disease could do if you get it. So I think the answer to that is we should focus on the benefits. And if we get side effects, there is a system in place by which you can report it. So there's a coronavirus yellow card scheme, which if you put it in Google, it will come up. So if you think you have a very bad side effect and you're concerned about it, what you want to do is to report it. And what that will do is that would inform the authorities. We will know better about it. They will investigate it. And based on that, we will be better informed and things can be put in place to deal with that in the future. But I think you have to leave to be able to sue the companies. And the companies have produced vaccines for the benefit of mankind. Thank you.
Thank you very much. I'd like to take some live questions. I don't know if there's anyone that would like to ask a live question. If you raise your hand, then I'll be able to see that your hand is up.
Bumi, while we're waiting, can I just take a couple of comments from the chat that relates to the components? So Nigel and Sarah Helen asked, why sucrose? Is that fake sugar? Nigel, sucrose is basically your normal sugar, the one you'll put in your tea or your coffee or whatever you drink. So it's not different. It's just the scientists like to use strange names to call things. That's why they call it sucrose. They might as well have put sugar there and nothing will have changed. So I hope that helps. There's also a comment from Kirsty asking about pathogens. My interpretation of that, and I could be wrong, and if I am, Kirsty, please write a comment or raise your hand, is whether are you wondering if the vaccine contains pathogens? Kirsty, there is no pathogen in the vaccine. So just to break that down from the sort of the jargon there, the vaccines contain no viruses that can cause infections in human beings. So you can be confident that there is zero chance, and that's absolutely zero chance of getting an infection of coronavirus from the vaccines. And the reason is that it does not contain the virus that causes coronavirus. And if that doesn't address your questions, please feel free to raise your hand or to write more comments. Thank you.
Just to add, Dr. Linus, there have been some occasions where people have said, they then tested positive after having a vaccine. And it's important to address that actually those people that did test positive, it wasn't because of the vaccine. It was most likely that they'd caught COVID and were asymptomatic prior to having the vaccine. And that's a very important point that people really need to understand, that it's not the vaccine that's caused the COVID. It would have been some sort of prior sort of exposure to COVID that's led them to getting COVID in the first place.
Thank you, Dr. Saleh. I'd also like to add on to that. So that's one of the reasons why you might test positive after you've got the vaccine. The other reason is when you get the vaccination, it actually takes up to 2 weeks for you to build full immunity in response to the vaccine. And if in that period, there is a chance that if you came in across with the virus, you might get the disease. And that is why it's very important that when you get the vaccine, you still have to continue following the guidance, which is hands, face, and space. So I thought it's very important that we mention that, because we've had cases where people have had one dose of the vaccine and they've immediately forgotten about the rules, gone out socializing, and that could be very risky, because in the first 2 weeks, your body may not have built up enough antibodies to help you fight that virus if you come across it. The second question I'd like to answer is on the chat. And Kirsty, I love your interaction. Well done. That's what we're looking for. So on here, it says the yellow card has listed lots of side effects. For example, sight problems and blood problems. I'm glad you mentioned that. And that is the purpose of the yellow card scheme. So for example, after this session, if everyone picks up a box of paracetamol and looks at the patient information leaflet inside it, you probably will never touch paracetamol again. Because what the yellow card scheme is meant to do is to mention every form of side effect. So if it happens in just one person, it's worth mentioning. If you read the leaflet in paracetamol, you see things like liver damage. But what percentage of people actually have liver damage? That's what we need to think about. So the yellow card scheme is to document every possible side effect so that in future, we can then look back and give guidance or even find ways to deal with it. So the fact that it's listed a lot of side effects simply means people are doing the right thing by documenting every form of side effects they are worried about. And what the MHRA and the authorities will do is then do some safety monitoring about the vaccine so that we can get more information and we can get more solutions to it. So I would say it has a good thing rather than a bad thing. Thank you.
Thank you very much. I can't see any hands raised.
I would like to answer Lorna's question, which is a really good question about immunity after the vaccine. At the moment, we know they provide you after the second vaccine, after the second dose of either of the vaccines, you get immunity up between 6 to 9 months, depending on each individual. We're very different, as we all know that. And the second part of the question was, would we have reboosted every so often? Yes, probably, very likely, based on if there are new strains discovered, and also you asked if it would be similar with the flu vaccination. Very likely they would be the same. If Dr. Barati wants to complete me, if you've got anything to add on that, you're welcome, Dr. Barati.
I think Dr. Barati has some connection problems, so she'll join us in a few seconds.
Or anyone else?
Yeah, I want to not to speak to the point which I think you've already made in a good way, but to answer some of Kirsty's other questions, and like Dr. Kuku, it's really nice that Kirsty, like everyone else, is engaging. So she made a comment about the reported deaths in Norway. And for people who are not familiar with this, very early on in the vaccination period, there were reports of deaths in care homes, nursing homes in Norway after having the vaccine. And they did an investigation into this. And it turned out that at that point, the Norwegians were giving the vaccines to people who were terminally ill, people who were really seriously ill and very poorly. And that was why, there was that association. It wasn't as if the vaccine necessarily caused those deaths, but if you give vaccines to people who are on end-of-life care, yeah, these people will have potentially passed away anyway. And their deaths, as unfortunate as it was not exactly due to the vaccine. Just to put things in context for you, Kirsty, Norway is a country of about 5.5 million people. It's less than the population of London. We give more vaccines in the UK in a week than Norway will ever give in its entire population. And if the vaccines cost 23 deaths in Norway, imagine the number of deaths it will have cost in the UK. But we haven't had any such incidents in the UK. And the reason is that we're lucky in this country that the way we give our vaccine, we're really very careful. The NHS is a really good health service, and we don't give it to people who are very ill. And if you're ill, they will tend to wait for you to recover. And that's exactly why we haven't had reports of death. So those reports were a bit of a fluke, and they have been since disproved. And if you think about it, since the Norwegians did investigations and made changes to their protocols, there has been no further reports of deaths in Norway. So that tells you that whatever caused deaths has been corrected. And I hope that that answers the concern. Thank you.
Thank you very much, Dr. Linus. Just another question here. I've had my vaccine and had a 48-hour reaction, whereas my husband didn't have any reaction after taking his vaccine. Someone mentioned that AS blood group patients do not react, but AA blood group patients do react. Is this just a myth or is it true? Thank you.
I'll be happy to answer that. So this is about side effects. I first of all like to talk about the potential side effects of the vaccine, the ones we're aware of. And it just comes to mind that we need to state clearly that whatever information we're sharing with the group today is based on available evidence, current evidence. That might change tomorrow. So whatever we're sharing with you now is what we know for now. Because it's evolving, the evidence changes as more information comes, becomes apparent. So we need to be aware of that, and we need to look out for updates. So the available, the common side effects will be pain at the injection site, not necessarily swelling, also fatigue, headache, body aches and pains, fever, and for a few, uncommonly, will be enlarged glands. I had the vaccine, and I had the Oxford AstraZeneca vaccine. And what happened to me was the day after, I was tired. Come on, talk about tiredness. It was extreme lethargy. We're very honest. And I had a headache that was like a migraine. But the good news is all I had to do was to rest, take a lot of fluid, water, take pain relief paracetamol, and within 24 hours, I was fine. So when you get the side effects, what you need to remember is that these side effects are one, temporary, two, they are reversible. And you can get side effects to any medication or any vaccine. That shouldn't prevent us from taking the vaccine. So two people got the vaccine and two people responded differently. That is because we are individuals and we respond differently to different things. The fact that you respond to it with side effects simply means your body is actually responding and mounting an immune response. The other part of the question is one person more immune than the other? It is needful to say that if you are on immunosuppressants, medications, or if you're compromised in one way or the other, your immune system is compromised, and this could be due to several reasons. You could have cancer, you could be receiving treatments that would reduce your immunity. This cohort of people may have a delayed response. But what I'd like to emphasize in there is that a delayed response is better than no response at all. So people like that need to take a bit of extra precaution because it might take your body longer to produce those antibodies, but you will still get some form of protection. So I hope that answers the two bits to the question. So if you're immunocompromised, the answer is still go ahead and get the vaccine. So if you're on steroids, if you're on treatment for joint pains by the rheumatologist, they have put guidance out there saying, please go ahead and get the treatment. If you're on chemotherapy, talk to your consultant, talk to your oncologist, because sometimes the timing of the vaccination is important. So if you are in doubt, talk to your healthcare professional. But the encouragement out there, the guidance out there says you're better taking the vaccine than not.
Dr. Kudu. Thank you very much. Just a reminder that if anyone would like to ask any live questions, please raise your hands. You would be able to unmute yourself and ask questions. I can't see any hands as yet, so please raise your hand virtually and you'll be able to ask a question. I'll just ask another question while we're waiting for the live questions. How long does the vaccine's protection last? And that's to Dr. Barati.
So this is a relatively new vaccine. So we are not sure how long the protection will last. It should be at least a year, but based on our experience with previous infections and our previous vaccines, we think it should last at least a year, but we are waiting and research is going on and we will know in due course. At the moment, we are not sure, but it should last at least a year, we think.
Okay, I still can't see any hands. So if you're unable to turn to raise a virtual hand, turn on your camera and raise your hand, and I'll allow you to unmute yourself and you'll be able to ask a question. The next question is if you...
Pauline Williams.
Pauline Williams, and I think Sam and Angie. I saw Sam and Angie raise a hand.
Okay.
Yeah.
Okay, so Sam and Angie, or should we go to Pauline first? Please unmute yourself and ask your question.
I'm just wondering, I had no reaction at all to my first dose. So what exactly is my position? Because I have heard before that if you have a reaction, it's better than if you don't have one. You know, and I would feel as if nothing went into my arm at all, because there was nothing at all. So I just wonder what the, position is on that.
Sorry, yeah, I'm not mute. Thanks, Pauline, for asking that question. The fact that you did not have a reaction does not necessarily mean that you are not protected. Just as we said, this is a new vaccine and we're all learning new things from it. What will be useful, I think the recommendation will be to actually go ahead and have your second vaccine. If you get symptomatic, with regards to if you have symptoms of COVID-19, then that will be a time to test to see if you do. But the fact that you did not have any side effects doesn't mean you haven't responded to the vaccine. And that shouldn't prevent you from getting your second dose. Are you on any form of immunosuppressants?
Sorry, could you say that again?
Yeah, my question was, are you on any form of immunosuppressants?
No, nothing at all.
So
No,
I wouldn't worry about it, because not everyone gets side effects to every form of medication they come into contact with. And watch this space, watch what you're asking for, because you might get it with the second dose. That's just a little joke.
I'll add to that what Dr. Kuku was saying. People react differently to the vaccines, but some will have some mild symptoms, some will have nothing, some will have flu-like symptoms for a couple of days. But even if you don't have, your response should be fine. You should develop immunity.
Thank you very much for that, Dr.
While we're on that, there's a question on here that might actually also go on the back of that. And this is from Terry Smith. Sorry, I'm not good at typing fast enough, so I'd rather just answer it. It says, do you still need to have the vaccine if you've had COVID? NB, I've had the vaccine, no side effects. So Pauline, that's someone else who's also had the vaccine with no side effects. Terry, the answer to that is, if you've had COVID, the recommendation is that you should still go ahead and have the vaccine. The reason being, there is evidence from the Siren report released by the Public Health England, which showed that for people who have had the COVID infection, they have 83% immunity for an average of 5 months. So that means you are protected for a limited period of time. So the vaccine will extend your immunity and the protection against the deadly virus. So the fact that you've got COVID-19 doesn't mean you shouldn't have the vaccine. Please go ahead and get the vaccine, because it would help boost your immunity and your immunity will last for longer. The other side to that is for people who actively have COVID-19 now. So if you have COVID-19 now, and there are two groups of people in there. There are people who are asymptomatic, but then have a positive test, antibody test, saying they have COVID-19, or those who are actively symptomatic. If you are in any of those groups, the recommendation is that you defer your vaccination for 28 days. So you can go ahead and have the vaccine, but please leave a gap of 28 days from when you get the symptoms or when you get that result saying you're COVID positive before you get the vaccination.
Thank you very much. We'll just take some more live questions. So I think Sam and Angie had a live question. Please unmute yourself and ask your question.
Hi guys, just a quick question. Just wanted to know, there's obviously other diseases and things that have a higher, can you hear me? Just making sure, yeah. There's obviously other diseases and things which have possibly higher death rates as well, such like things like cancer. But how is the vaccine for COVID-19 done so quickly? The things like cancer, which has been around for so many years, hasn't been done yet?
I'll answer and then I'll let Linus do better justice to it. So I think Linus alluded to something at the start, which I found very profound. Cancer affects individuals. What this coronavirus has done is it has affected populations. It has affected nations. And that is probably why the focus on producing the vaccine has been more than on individual cancers. I'm believing that going forward, the lessons learned from finding a solution to a pandemic like this will be used to address other issues like cancer and these chronic diseases that we're all fighting. But the difference here is that this is a pandemic. Everywhere, all over the world, there's hardly a cancer that affects the whole world at once. So I think that is why there has been a difference with the promptness of the production of the vaccines for this. And that's why we've said the things that have happened is things like scientific collaboration, funding put into it, volunteers coming forward. So that's very different. And I think that's just a different, but I'm hoping going forward, we will learn the lessons and use them to address these other issues like cancer and other illnesses that affect mankind. Thank you.
Thank you very much, Dr. Kuku. I'm now going to ask Benonia. Please unmute yourself. Benonia.
Good evening, panel. Thank you so much for what you've given to us. I just want to add to the lady, I don't know whether it was Pauline. I also took the vaccine. I didn't have any reaction at all. At the back of my mind, I feel I may be with is it a 20% or whoever who are not effective because it's not only 100% vaccine. So there is that little niggle in me that maybe is because it didn't do anything. It didn't cause my body to form antibodies against this thing. What do you say about that?
I think my answer to that is I wouldn't worry about it. The reason being, what we're doing here is actually giving evidence. The evidence out there is that when you get the first dose, on the average, depending on which vaccine you get 70 to 90% protection. So that's 70 to 90% of people are protected. By the time you get the second dose, then it moves up to about 95%. I will say you're better getting the second dose as a follow-on on the first one, but I wouldn't worry about the fact that I did get side effects. Let's think about it. When you get the flu vaccine, some people get side effects. They get it so bad that they say, I'm not going to have it again. And some people don't get any side effects at all. Sometimes I have found when I got my first flu jab, I had side effects. The next time I didn't. So we're all different, just like Dr. Bahati said, we respond differently. And you're not getting side effect doesn't mean it's not effective with you. So I wouldn't worry about it. I just go ahead and get my second dose.
And Benonia, if this helps, Benonia, so when they tested these vaccines, and indeed, if every time they test any new medication, I'm going to tell you something which is really funny. So when they test the vaccines, they have two groups of people. One, they give the main vaccine. The other group, they give maybe like plain water or something like that, something that is completely inactive. And guess what? Very often, people in the water side of the tests come back and report quite dramatic symptoms. So it's just to explain that the way we respond to these things it's a player of the body and the mind, and that's just the fact of it. And we shouldn't read too much into it. That is definitely not a way to check whether you've responded to the vaccine or not. I hope that helps. Yes, come back, Benonia.
Yes,
you want to say something?
I think my main question is not the worry about not reacting. In fact, I prayed that I shouldn't react.
Right.
However, my question is, how sure am I that I am in the protected group? Because the vaccine is not 100%. So am I protected?
Yeah,
and so because I didn't have any reaction, then my mind goes on to that. Not because I pray that I shouldn't have a reaction. So I'm very pleased I don't have
apologies. I think I
reaction.
misunderstood that question. And I believe I now understand it. And I think the problem comes from we're trying to explain these things without using jargon. And in that process, some meaning is lost. That's just unfortunate, but that's the way it is. So when they say 95%, it doesn't mean that if you gave it to 100 people, that 5 would not be protected. That's not what it means. It means that if you gave it to 100 people, for every one of those 100 people, 95% of the time, each one of them is protected, but the other 5%, they're not protected. So the way to look at it is your risk of developing the catching infection reduces because of that protection. It does not mean that there are people that are not protected, that have 0 and others have 100% protection. That's not what it means. And the confusion, which I understand, is from when we try to translate the technical language used in science and medicine to sort of normal English, that is free of jargon, that a lot of meaning can be lost, unfortunately. Thank you.
And just to add, Dr. Linus, about the fact that there's also individual reduction of risk, and then it's the collective reduction of a large number of the population, that the highest risk people being vaccinated first, and collectively that will reduce transmission across the board. And those that do get it are likely to have milder symptoms. So it's the combination of both of those things: the individual reduction in your risk and the collective reduction over a wider population, which is that phenomenon of herd immunity that Dr. Kuku was talking about at the beginning.
Thank you very much, Dr. Saleh. I'm just going to hand back to
Sam has the hand up.
Sam.
And Angie.
I'm going to give it to him.
All right, thank you very much.
Sam and Angie, I can't actually see the virtual hands.
Sam and Angie
so I can't see the virtual hands. So, okay, if we take one more question from Sam and Angie, we'll then go back to Mr. Samtawade to ask some survey questions, and then we'll come back to some more live questions. I'm conscious we have only about 13 minutes more. Okay, please unmute yourself.
Oh yeah, so just asking a question on behalf of my dad. He's currently on strong painkillers like tramadol, tablets like those. Is the vaccine still safe for him to take? I mean, would there be? And I've got a patch as well. And he's got on the morphine patch too.
So the straightforward answer is yes.
Yes, it is safe. That means that obviously he's got some other medical issues. I presume that's the reason why he's taking that strong medication. So yes, definitely. There is no contraindication not to have the vaccine.
Sam and Angie, thank you. Thank you. Dr. Kuku, did you want to add anything to that at all?
I think Dr. Fiorina Ellis has answered it properly. For him to be on those medications, he must have some form of illness, which increases his risk. And the vaccine doesn't, people on medications are not excluded from taking the vaccine. So, Dr. Ellis answered it well enough. So yes, that's fine.
Thank you,
Doctor. He should go ahead and take it.
Thank you, Doctor. So I'll just go back to Mr. Samtawade, who will take some questions from the survey, and then we'll take some more live questions. Over to you, Mr. Sam.
Okay, so just bearing in mind that time is really ticking, I'm going to be asking any of you to answer this and as quick as you can, if possible. So, what is long COVID, and what do we know about the lasting impact of COVID infection for people of all ages? What is long COVID?
I'm happy to answer that. So like I said, the virus is what we call coronavirus to the layman. In medicine, we called it COVID SARS-2 virus. But the virus produces a disease called COVID-19. The disease affects people differently. So when you get the disease, you have 3 phases documented. You have the acute phase, which is usually the first 4 weeks. And a group of people will have the disease, get over it, and they've forgotten they ever had the disease. They make full recovery. Another group of people are those that have the ongoing symptoms, and within 4 to 12 weeks, they still have the cough, they have shortness of breath, they have a few complications from the disease COVID-19. And then there's a third group of people which could also be labeled as the post-COVID group. And these are the group of people that still have symptoms and complications after 12 weeks. What NICE has defined long COVID as are those that have ongoing symptoms from week 4 to 12 and above. So excluding those who have the acute illness and get over it, you have those group of people that have the ongoing symptoms and the post-COVID symptom. And these people are the ones that are included in the long COVID symptoms. Most especially those after 12 weeks suffer from symptoms that sometimes are unexplained. So you have things like brain fog, cognitive impairments, they can't remember, they're extremely tired. A lot of those symptoms are medically unexplained. Some are, and what this group of people do is, for example, in Bedfordshire, we have a clinic for them. So if you are suffering the symptom, you get booked into the clinic, and then you have further investigation and support. You need psychological support. There's the IAP service, there's the chronic fatigue syndrome service. So these services are in place to help you go through that period, hoping that you can get over it. Because at that stage, a lot of people need psychological support. So they ask you the questions, they go through the journey with you, and they exclude treatable causes. Because like I said, the COVID-19 virus attacks almost all organs of the body: respiratory system, cardiac system, nervous and neurological system, even the clotting system. And I hope that explains what long COVID is about.
Okay. All right. Real quickly again, to any one of you doctors, how often will we need to take COVID vaccines? Will it be similar to the flu shot we need to take every year?
And if I can start and others can join, because it's a new virus. We are not sure at this stage. A lot of research is being carried out. It could be we need a booster. So at the moment, it's just 2 doses of vaccination, and we are going to monitor it and see how long the immunity stays, and do we need to take a booster again, or do we need to take it annually? So at the moment, we are not sure.
Okay. And somebody's concerned. Somebody says, will the vaccine fully protect me against COVID-19, or can I still catch COVID-19 after I've been immunized?
Yes, you
Yeah,
can still catch
it's possible that.
COVID-19.
Okay,
Go
go ahead.
Yes, you can still catch COVID-19, but the whole point of vaccines, every vaccine, is that it will help your immune system. It will teach your immune system to respond to that, to fight against that virus. So it's not new to your body. So basically, it reduces your risks of developing complications. It reduces your risk to have a fatal COVID illness, basically. So even if you get it, you will have very mild symptoms or no symptoms at all. So you still need a vaccine, basically. Yeah.
Okay. There's another one from me here. So a lot of people who hopefully have come here tonight, some of them are hesitant, some of them want clarity. So somebody's just asked the question on behalf of everybody. So what should I say to someone who is hesitant to get vaccinated? What should we be saying?
Vaccines save lives. Please take it if you're offered one. And they have been brought into the market after rigorous testing. The MHRA in UK is a regulatory authority, just like any other medicine. It has gone through rigorous testing and it's well monitored. They are safe, they save lives. And to date, the most recent evidence is even saying that it reduces the hospitalization and death by 80% in the over 80s, more recent evidence. And so please, if you're asked, if you're offered, please come forward and have the vaccine.
You might be healthy and have no medical conditions, and you might think, well, it's fine, I'll have it, or I had it already. But if you don't think about yourself, think about your loved ones, think about others, people around you. So you'll have to protect them by having the vaccine.
And just to remember that over 20 million people have had this, had one or the other vaccine currently, and there's been no one that's died from it. There's been no reported COVID-19 as a result of having the vaccine. So we appreciate it was fast in its development, but actually it's being monitored every day. And most people that have had it have had little to no side effects or no symptoms to worry about.
Thank you very much. Just to emphasize the number that you mentioned, Sally, millions have had these vaccines now, including in this country. And I have seen a few charts about deaths. We've talked about deaths in Norway. There was a second point in the charts about deaths elsewhere. I think the number I mentioned was 63. I don't know the particulars or the details around this particular report. What I would like to say is that in the UK, we actually have a really good system of reporting deaths and causes of deaths. And I would go by the numbers that we have here, which I know is very robust because I know how the system works. I wouldn't just take any reports off the internet. And if I just quickly answer a couple of things about the components of the vaccine, which has been raised since I last spoke. Somebody asked, I think, on the live question about nanoparticles and why we didn't discuss that for the components. So to that gentleman, the answer is that the nanoparticles were on the list that I showed for the Pfizer vaccine. If you look at that list and if you had a screenshot of it, the first 4 items were basically what makes up the nanoparticle. It's nothing special. It's just fat molecules arranged in a particular way. It's basically fat. There is question about luciferase. Luciferase is an enzyme. I'm sorry if this becomes technical, but there's no other way to explain it. Luciferase is an enzyme that scientists use in the lab. There is no luciferase in the vaccine. So to the gentleman that asked about luciferase, there's no luciferase in the vaccine at all. Luciferase is not used in human medicine. It's used in labs to develop medicines and things like that, but it doesn't actually, it's not a component of the vaccine. I hope that helps. Thank you.
All right. Does anybody still have any question? I think what we're going to do as we wind down now, I think Terry's hand is up. So if you want to unmute yourself, Terry.
And Chantel and George.
Okay. Terry, you want to unmute yourself, please? Good.
Hi. Yeah. The same question in fact is I'm pro-vaccine. I've had it myself, as you've already mentioned. My question is, I've been told that by having the vaccine, I think other people who are clinically vulnerable. But you've said that it doesn't, having the vaccine doesn't stop us from getting the virus and spreading it. So how does it help the clinically vulnerable people by us having the vaccine?
Sorry, you are breaking off, Terry, so it might be worth repeating it again.
Yeah, okay. Let's try again. Percy's asked the same question in chat. I'm pro-vaccine. I've had it, as you mentioned earlier. We've been told that by having the vaccine, we protect the people who are clinically vulnerable. But it's been mentioned that the vaccine doesn't actually stop us from getting the virus or spreading it. So how does it help the people who are clinically vulnerable by us having the vaccine?
It reduces the complications. Even if you get the virus after you got your vaccine, yeah, if you still get the virus, you might get no symptoms at all, if it makes sense. Or if you do get some symptoms, there will be very mild symptoms. You don't get complications. You don't get lung infections, chest infections, so you can get So you need to go in the hospital and end up on a ventilator. That's the whole idea. So it reduces the chances to develop complications. So you get a very mild form. Does it make sense?
Yes, but how does it protect other people?
Sorry, I didn't hear that.
Right. We've been told that by having the vaccine, we protect people who are clinically vulnerable. I'm just not quite sure how that works.
So the question is, the question was, how does it protect other people?
So we've talked about herd immunity.
Yeah.
So when you get the vaccine, we've said it's twofold: to protect yourself and also the population. So the more people that are vaccinated, the reduction in the spread of the disease. And therefore, there's some people that, because if the virus, so the more virus we have out there, the more people are going to be affected. The more vaccination that is given out, the lesser the spread of the disease. So the vulnerable are less at risk because they would not have to fight against such a large quantity of virus, if I can put it in layman's sense. So it's almost like you're fighting a battalion, 1,000, and fighting 10. The risk, if you're fighting 1,000, is more than if you're fighting 10. So that's the lay way I can describe it. Because the more people that get vaccinated, the lesser the virus in circulation. When we talk about transmission, we're saying we don't have evidence, but it does reduce the risk of transmission. It's just we do not have available evidence. And that is the problem with science, because evidence is evolving. With time, we will have more evidence. Like Dr. Barty just confirmed now that 80% protection has been found. It takes time to gain evidence. And also, the more the number of people that get the vaccination, the lesser the mutant. The virus is able to mutate. So we'll be talking about variants. So the more the people that get the vaccination, the less variants we have to deal with. So I don't know if that helps.
Okay. Thank you very much for that, Doctor. I just want to draw your attention to the fact that we did say the program will stop at 8:30. So I'm going to crave your indulgence now as we begin to round up. There's still a couple of questions, and if people have been here for an hour and a half, it will make sense that their questions are answered. So as we begin to round up, doctors, I'm just going to ask that we look at individual questions that is being raised, and then we use that as a roundup. After which I'll call on Richard to now say bye-bye. So if you want to start for me.
We've got Chantel. There are two people that have raised.
So that's what I'm saying. So Bumi, what's going to happen is the people whose hands are up, the questions are going to be asked and answered. But bearing in mind that whoever is answering that would also be using that as a final thing to round up for when they do speak as doctors. Okay. So Bumi, you want to carry on with Chantel?
So I think, Mr. Sam, I'm going to ask you to take the virtual questions. I can't see the virtual hands. It might be a setting on my Zoom.
Okay.
I can only see the videos when people raise their hands. So please call on the virtual hands.
Okay, Chantel, we're ready for you.
Hi, can you hear me?
Yes, we can, loud and clear.
Oh, that's great. Thank you, everyone, for your availability and all of that. I guess my question, coming from all kinds of perspectives, to be honest, I'm just wondering, I've looking into some of the stuff that I've read and people have shared with me, it seems like ivermectin, I'm not sure if I'm pronouncing that correctly, but that seems to be more effective than some of the vaccines that we have. So I'm just sort of interested in, I know the question was posed earlier in terms of other things that we can use instead of the vaccines. I guess, yeah, so my question is, why are we not, if ivermectin is more effective than the vaccine, can't we push that instead of that? Instead of the vaccines? And the other thing is, I guess, coming from the Christian perspective, No, I'll leave the ivermectin question, and then I'll share the other question another time.
Okay, who's going to help us with that, doctors?
Yeah, I'm happy to talk about ivermectin. So it's a medication used to treat worms, and there has been some reports that it could be used to potentially treat or prevent COVID-19. The fact is that I haven't seen any scientific evidence to back that up. There has been a few trials done to check if ivermectin can help stop COVID from developing into serious infection. And the ones I have seen 2 in the last couple of weeks. And the 2 trials reported that there was no effect from ivermectin. So there is no scientific evidence to date that shows that ivermectin is useful, whether in prevention or treatment of COVID-19. Now, of course, this is a new condition and evidence is changing all the time. I think that until we find that reliable, properly conducted trials showing that evidence, that I wouldn't recommend ivermectin for that particular use. Thank you.
Sorry, Dr. Kuku, you did say that Chantel and somebody else had their hands up.
George,
I can't see George at all.
KOPC.
George, are you still there, George?
He's there, yeah. He's still raising his hand.
Oh, George.
George, unmute yourself. Yeah.
You need to unmute yourself, George.
Hello, can you hear me?
Yeah.
Okay, hello everyone. Thank you for what's happened so far. Just wanted to check, does the virus actually minimize in any way the transmission between individuals at all? And if it doesn't, are there any technical or scientific ways that could be added on to a future version of the virus?
You mean the vaccine? Does it reduce the transmission? So to date, there's not enough evidence to say that it reduces someone transmitting the virus to others. That's why we really stress on other public health measures, even though if you've had the vaccine, the hand space and space are really, really important, and sticking to that. And also if you've had some recent illness, please self-isolation as well.
Thank you. Thank you, Dr. Bharti. I just thought it's quite important to answer. There's a question on the chart, and I thought it's very important to answer that. And this question is from Joe. I'd like to say from all of us, our heart goes out to you. I'm sorry to hear about the death of an aunt. So she says, I have an aunt who recently died in London. After 2 days of taking the vaccine, they found she had a clot in her lungs. The bit I want to answer first, and thanks to my colleagues who have answered it, but I thought it's quite important that we actually talked about that. So your aunt who died and was found to have a clot in her lungs, the evidence out there does not support any vaccine causing clots in the lungs. The COVID-19 vaccine does not cause clots in the lungs. However, COVID-19 disease could cause clots in the lungs. So it is possible that she may have had, like we said it, she may have had COVID-19 before she got the vaccine. And her death may have been related to the disease rather than the vaccine. I have colleagues and relatives who have died from clots in the lungs following COVID-19 disease. So it's and I think it's sad to hear that she died 2 days after the vaccine. And what we're finding, the evidence out there is that the deaths that have happened after the vaccines are, for those that have been investigated, it hasn't been found to be related directly to the vaccine. For most of the evidence, it is related to the disease rather than the vaccine.
Okay. All right. Thank you very much. Like I said, we were meant to finish at 8:30, but everybody will agree with me that this has really been rich and it's been a blessing to people who have been listening. So I'm just going to call on doctors to round up now. So I will start with Dr. Barasti. So maybe in the area of public health, if there's something you want to say that you feel is going to be important for people to know before you round up, or any information you want to pass to the people. So we want to start with you, if that's okay.
Thank you. Thank you very much, Sam. So I would just like to reiterate that vaccines save lives. And we've had, that's how vaccines have really helped us in eradicating smallpox diseases in the past. And it's because of vaccines that measles and diphtheria and other deadly diseases have been kept under control. So please, if you're offered a COVID-19 vaccine, we can all assure you that it's gone through rigorous process and it's really monitored well and it is safe. If you have any questions, please go and approach your GP and go to websites which are trustworthy. Like in the UK, it's NHS and gov.uk or any other professional organization rather than social media or internet. There's a lot of misinformation. I hope this session has helped clarify many of your queries. And so if you're offered vaccine, please go and have it. And I would like to stress that it's a very challenging time for all of us. Let's not forget our physical and mental well-being. Reach out to others. Let's volunteer. Let's take care of your physical health as well. Even though we are at home, try and do some exercise that really helps us to get through this challenging time. So please take care of your physical and mental well-being and your family and friends as well. Thank you.
Thank you very much, Dr. Barathi. We've actually been blessed by everything you've implanted today. So thank you so much. Dr. Sally, should I come to you and then you round up, please?
I don't have a great deal to add, just to say thank you for listening and thank you for your time. This is the biggest healthcare issue we've faced in our lifetimes and in generations. And the vaccines are safe, they're effective, and they will hopefully help us out of these dark times that we've all been going through. I've had it, I've recommended it to my family, and I would recommend it to anyone. And I would say, if you have specific questions that have not been answered today, please contact your GP or contact your doctor, or even there may be some way of getting in touch with us through email or whatever. So if you have some misgivings, then please contact someone from the healthcare profession that will hopefully be able to allay some of those fears. And ultimately, you still have the autonomy to say no, and you will always have the autonomy to say no. We just want you to be able to have made that decision based on the right information and not things that you may have that may have been passed on via WhatsApp or Facebook or something or other. And that's really the crux of why I'm here today. Thank you.
Thank you very much for that. Dr. Ellis?
Thank you so much for joining us this evening, and I really hope that you found it useful, and I hope that you got some information there and you will reflect on it and you'll make the right decision for yourself. And as my colleague said, yes, go ahead, speak to your GP, ask for more details, look at NHS Direct, COVID, public health, but do your reading in the right places, basically, and ask the right people. And yes, Lorna said that she found it really useful, and I'm very pleased to hear that. And she says we should have done this earlier. Amazing. So I'm really pleased about the good feedback from our listeners. Excellent.
Thank you very, very much. Dr. Linus?
Hi, Sam. So thank you very much to all the guests tonight, especially the ones that stuck in till the end. I have learnt a lot tonight. I hope that you've also learned a few things. And can I just say, these times are not normal times. This is the biggest challenge that we've faced since the last big war in Europe. And what does that mean? It means that we need to pull together as a community, and we need to look after one another. And how does that, in practice, what that means is that for us as doctors and scientists, we can talk about all the fight, but actually to be able to get to normality, some kind of normality, we all need to help. And one way is to share your experience and the information you've had tonight, and to participate in conversations with your family and friends and in the community, and help counter the dangerous information that is making the rounds. And some of these sort of untrue information, misleading information, can actually come from sources that wish harm to our society and our country. And this is why it's important for us. This is like a war. We're fighting a disease that's changed the way we live our lives. I think it's really, really a call to arms that we can make a difference. The people that spread this information, they're not experts or scientists. So there's no reason why we shouldn't feel that we're able to share correct information, or at least point people to the right place to get the correct information. Thank you very much for giving your time this evening.
And finally, Dr. Kuku.
Thank you, everyone. I think we're pleased that you took time out of your busy schedules and weekend to join this conversation. For everyone who's asked a question, thank you. For everyone who hasn't asked a question but listened, thank you. I'm hoping everyone has learned something new. I'm hoping everyone has been empowered to make the right decision concerning the vaccine. I am aware that we haven't been able to answer all the questions, and some people will have more questions going forward. I'd like to say to you, if you have questions that haven't been answered, on my screen behind me, you can see Healing G Zone, and that's because I'm so passionate about COVID-19 that I have gone on social media. If you go onto Instagram at Healing G Zone, DM me and I will answer your question. The other bit to it, that is, if there is an answer to it, because I don't have all the answers, the other bit to it is there is a QR bar on behind me. If you put your phone against it, you will come up with a form which will ask for your name and your email address. The reason why that is being done is I have put together an ebook answering questions on COVID-19. So you can get that ebook in your email box once you've given your name, your email address, and there's nothing to it. You just get the email, you get the document in your email box. Finally, I'd like to say, please look after yourself. We are in lockdown in the UK, but the fact that you're locked down does not mean you shouldn't look after yourself. So do what you love to do. Read a book, play music, sleep well. You can exercise while at home. Make healthy choices with regards to your diet. And there is light at the end of the tunnel. For us to get to that light, we need to share the good news. Vaccines are safe. The COVID-19 vaccines are safe. They are one of the major ways we can get out of this lockdown. So please, whatever information you have gained, share it with each other, make the right decisions, and very soon, I'm hoping we'll all come out of the lockdown and get back to the new norm. Thank you for listening.
Thank you so much. Thank you so much. The diverse people we have here is a testimony to the fact that people need this knowledge and that they're seeking for it. So thank you so much for that. This is the second event that we've organized, and it's been well supported. Now, for me as a community leader, I think I must say thank you to everybody, all the doctors who have taken time to be able to do this tonight. You didn't have to do it, but you've done it. And I think that a lot of people must have been blessed by some of the things you've said today, or empowered. So we really appreciate you. Specific thanks goes to my co-host, Bomi, who I called at the very last minute, and she obliged, and you would agree with me that she's done a fantastic job. So thank you very much. Now, it's important I call Richard Green, the pastor of all nations, to say the last word. The reason being that he's a man that is very passionate about the community, and he said to me that he's very aware that there's a need for this to be done in the community, and he's decided to work with me, and that's why we're here tonight. So we're rounding up now, and I'm going to call on Richard to have the final say.
Well, Sam, thank you, and thank you to just an amazing panel. And thank you so much for all the time that you've given up. You guys are busy throughout the week. You're doing all this all the time, and then to come up and give time just to serve us tonight. We are truly appreciative of what you've done. And I want to thank you for the excellent way that you've served us and served so many people who've watched tonight. Thank you so much. And I'm not going to add anything more other than I'm very grateful that we can all be in this together. I'm very grateful that we together, with all the different questions, all the different answers that we've been able to share, we will be able to move forward and get out of this situation. And I think it's really important that we keep dialoguing, that we keep those questions and answers coming in. And I think for me, the answer is this, that you have to have a very good reason. And obviously everyone has the right to make these decisions personally, but you have to have a very good reason why you would not go ahead if this vaccine is offered to you. I hope tonight that we've been able to give some good answers as to why you should, but of course, at the end of the day, if you've come up with a different conclusion, at least you've come from the good place of information rather than misinformation. And that's where we want to really leave it. So guys, thank you so much. And we'll be in touch with you soon, I hope, again. And have a good rest of the evening. God bless you. Have a great weekend. And we hope to see you soon. All right.
Thank you.
Bye. Thank you.
Bye-bye, everybody.
Bye-bye.
Thank
Bye.
you.
Thank you.
Thank you. Bye.
Bless everybody.
Thank you so much. Been really
Thank
good.
you.
Well done, everyone.
Can
Thank you for your
I
help.
challenge you all to make sure that you're telling somebody? For every one of you who have said you weren't going to take the vaccine and you end up taking it after all this information, could you also make sure you're passing the word around that you have taken it and you're fine? So please, let's do that too. Thank you so much.
Thank you for your help.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everybody.
Thank you, everyone.
Thank you. Wow. We got there. Thank you, George. Thank you, Pauline. Thank you.
Thanks for your help. Thank you for your patience with all my questions. Thank you.
Oh, Chantel. Thank you, everybody.
Thank you.
Thank you, George. Thank you.
Hi, Dyer. God bless
Thank you. Thank you, Kirsty.
Thanks for your patience.
Thank you. Thank
You
you.
were good. Thank you.
Thank you. Thank you.